okay?
There you are. All right.
We're back on shift inside the ambulance.
It's on. It's on.
Let's go! With more medical emergencies.
Mate, is that a little bit better now?
And more cameras.
Do you want me to turn you on? Yes, turn me on, girl, turn me on.
We're taking you back to the heart of the action.
It's a sharp scratch of code.
There are some new faces.
This could potentially be quite hazardous.
And some old friends.
Seriously?
Oh, that's disgusting.
Body-mounted cameras record every moment
Nice and slow.
to show you what goes on behind closed doors.
Caroline, can you hear me, sweet?
Crikey, that is a chunk.
You'll be on the front line with the paramedics from the West Midlands Ambulance Service.
I reckon you could do this job, you know.
Woohoo!
Take a big deep breath and hold it for me.
Never a wasted moment when I'm being paid by the ambulance service.
As they deal with 3,000 emergency calls each day.
There's nothing to worry about.
That's not too bad, Petal, is it?
You were eager to come into the world, weren't you, Chicky?
Step inside the ambulance.
I love this job.
So you don't want to be like, I won't want to be like Batman. He's just rich, isn't he? He's not got any actual superpowers.
No, not really.
Superman's just a bit too super, isn't he? Like,
Yeah.
I don't want to be the Hulk.
No.
Because every time I like turned into the Hulk, I'd lose all my clothes. I couldn't be Spider-Man because I don't like spiders. Iron Man's just rich as well. Probably Thor, you know.
I was
He's a
just
Greek god,
thinking
isn't he?
Thor. And you like playing with hammers.
What superhero would you be?
Well, I'd like to be Wonder Woman and look at myself in the mirror, but that's beside the point.
It's coming to the end of a busy 12-hour shift for ambulance crew Hannah Simpkins and Michelle McNulty.
Went in a pub yesterday and it said, a sign said, naughty children will be sold to the circus.
Hannah and Michelle have been working together for nearly 2 years.
I remember people saying that to us when we were kids. You carry on, we'll send you to the circus. I just think, brilliant. I'd love to go to the circus. When I was a kid, I used to climb and jump off everything.
A new job has just come in.
Patient sat in the black Ford car opposite the health centre on the corner of the junction.
The patient's daughter called an ambulance when her mum started complaining of chest pains.
Hello, sweet. What's your name, darling?
Susan.
Susan. What's been happening, Susan?
Just drama.
You've had pain in your chest? Okay. Have you had it before?
Susan and her family were on their way to pick up a takeaway when the pains started.
Take some nice deep breaths. Try and keep your eyes open for me, OK, so that we can keep an eye on you. First thing we need to do is get you out the car, OK?
Yeah.
All right, so I'm going to open your door first, all right? So just tuck your arm in so I don't grab your elbow. Right.
Susan is a busy grandmother with 8 grandchildren, but she also suffers with anxiety.
Susan, look at me. You're going to be OK? All right? We'll get you sorted, all right? We just need to get you out this car, all right, sweet? I'm going to sit in this very fetching pink chair here that I won't quite fit in.
It seems like Susan is having a panic attack, but Hannah wants to get her inside the ambulance to check her vital signs.
Are we ready?
That's it. OK, Susan?
There we go. Now walk with me and pop your bottom on there. That's it. That's it. That's it. All right.
That's it. There you go, Susan. That's the worst bit. OK, well done. Right, we're going to pop you onto the back of the ambulance, Susan, OK? Nearly done. last one. All done. Susan, you okay? It's all right. Some tissues, sweetie. All right.
Just relax this arm for me, Susan.
Susan, look at me. Look, I know you're in pain, okay, and I know it's not nice, all right? But just try and relax for me as much as you can, okay? Nothing bad's going to happen, because we're with you, aren't we?
Just stupid.
Something stupid?
So little.
Well, that's all right, then, isn't it? There's nothing to worry about. Okay? I know. And I don't blame you. Since I've been in the service, I've seen an increase in the amount of people that are suffering from panic attacks and anxiety and things like that. It's difficult to say, really, why more people are suffering from it than they would do normally. There's more stresses and strains in life, which is causing people to have anxiety and things like that. Susan, listen to me. Are you under a lot of stress at the moment?
Yeah.
Yeah? What's been happening at the moment that's been stressing you?
Oh, God, everything. Depression had got him worse, and it ain't helping, and then they've stopped me money, and then ESA won't help me because depression's not good enough on the sick note. And
Yep.
nobody's bothered now, so I'm just...
Have you ever suffered with anxiety in the past?
Yeah.
Okay. Have you ever had tightening in your chest similar today when you've had them in the past?
Yeah.
Yeah? Okay.
These were just, it come from nowhere, and it was so hurt.
When they're having panic attacks, and normally people's heart rate goes up, their breathing rate goes up, which then makes them feel dizzy, which then gives them a tight chest, and so on and so forth. It's a very powerful feeling to have take over you.
Susan, have you ever had these sticky dots on your chest before? Okay.
Michelle still wants to check out Susan's chest pains, so does an ECG test.
How old are you, Susan?
56.
56.
Body's 96, so.
That's how I feel. Right, if you just stay still for me, no talking, just gonna do this trace of your heart.
The test monitors the electrical activity of Susan's heart.
See, I'm alive and kicking.
You are. You're still beating all in the right places, Susan. Do you prefer Susan or Sue, or you're not bothered?
Sue.
Sue.
Susan's in trouble, eh?
We'll call you Sue then, because you're not in trouble today, not with us.
The ECG isn't showing any abnormalities, but Hannah is more worried about Sue's blood pressure reading.
Your blood pressure's quite high at the moment. We can't categorically say one way or another whether it's something to do with your heart unless you have a blood test.
Okay.
And also, I wouldn't be happy for you to go home without seeing a doctor. I think what you're experiencing at the moment is something that people only really truly understand if they've been through it themselves. And trust me, I know how you feel. For that reason. And I used to get that feeling where it felt like your throat was closing and someone had got their hand around your throat. And I used to hate being on my own.
I was like that. The guy when you go to the doctors and you know it.
You can't explain to everyone it's like to feel nothing, but feel everything all at the same time. And how frightening it is.
Sue is starting to calm down.
Is it Sean, your son? Let me just go and double check, because I think he wants to come with you. Are you all right if Sean comes with you?
Yeah.
Yeah?
With Sue's son Sean on board,
You're right, Sean.
and the rest of her family following in the car behind, they head to hospital.
Ready whenever you are, Sean.
Okie doke.
Oh, my body's going to flout in my way.
Try and breathe in for 3. All right. Then hold your breath for 3, and then breathe out for 3.
Okay.
Okay?
Yeah. Ooh, it ain't working
You're
this
doing it.
time, I'm
You're
telling
doing
you.
it. Keep going.
You got 4 eyes.
Keep going. Keep focusing on that breathing. Make sure it's through your nose, Sue, okay? physically impossible to hyperventilate through your nose. Doesn't happen. Keep breathing, yeah? Okay. There we go. Right, little bump, we're going to go down the ramp, Sue. There you go, you're at the bottom. Still counting. In through your nose. Keep going then, in through your nose. I'll keep reminding you.
Twice.
That's really mean.
This
Where's
one's
my
better.
pen, you pikey?
That one's better.
Wow, I don't think there's been a cloud in the sky all day, has there? Oh yeah, there's one, sorry. Damn these observation skills of mine. Oh, funny.
It's been a busy evening for Hannah Meredith and Claire McCullough, and working nights is playing havoc with their eating patterns.
Yes, well, I need to get down to 8 to 9 kilos. So,
That's very precise.
my goal is by tomorrow, which I doubt it, is to be 99 kilos. I was hovering this morning, hovering on the 100 kilos mark. 100.3 kilos. Oh, so I need to either have another massive food baby.
That works. Do you ever do that? Like, just like go to like weigh yourself and then like decide that you need a really big poo, and then go and weigh yourself again and go, I must have lost some
Yes,
weight.
I've done it.
Yeah.
That's what I'm going to do tomorrow when I wake up. Right. Fancy a Mackie D's?
They've only got half an hour left, but there's no time for snacks.
999 road activated.
23-year-old male, chest pain, cardiac in nature.
Chest pains are the highest priority call-out. It's rare to go to someone who's just 23 years old.
Pain when pressing area.
Updated assignment.
This one here.
3 minutes later, they arrive.
Hi there.
They're met by the patient's brother, Akib. The crew's body cameras will record everything that happens inside.
Hi. My name's Claire. Have you called for an ambulance this evening? Yeah. What have you called with?
Really bad heart pain.
Really bad heart pain. Have you got any cardiac history at all? No.
Aman has been experiencing serious health problems for the last few months.
When I first saw him, he didn't look comfortable at all. He just looked really poorly, and his brother genuinely looked quite scared.
He's on loads of medication.
Right, okay. Have you got a list of that medication? Oh, right, lovely. I'll have a little look at this. So what kind of medical problems does our young man have then?
He sweats a lot during the nights. He's got testicle problems as well.
Right, okay. Is he under investigation for that?
Yeah, he did. Right now, they've done some CT scans and everything. And
Okay.
they've done some cancer scans as well.
Right, okay.
Aman saw his doctor that morning, who gave him painkillers for severe stomach and muscle pain.
Now they're thinking of stomach cancer, that's all they're saying. So,
All right. So has he had lots of ongoing issues in the past?
Yeah, they've given all these tablets and
So is it mainly in the stomach that he suffers with this pain?
testicles.
And and the pain sort of rises up. Right, I've got you. Okay. Is it painful when you move?
In my shoulder as well.
In your shoulder as well. Have you been heavy lifting at all?
Just need this one.
No? You're not done any, like, you know, throwing footballs or rugby balls or any kind of sport and activity or...
He's not been feeling well for a long time.
I mean, I looked through his box of medications. He was on some really heavy-duty pain relief. Upon looking at that, we're like, well, we can't really give him anything more because we could end up overdosing him. So it's a case of, well, there's got to be something going on here. What about round here? It's all tender.
Yeah,
Oh, yeah. Yeah. You've got some knots in your shoulders.
Aman's lymph glands are swollen and his heart is racing too.
Yeah, I need you to keep really still for me, OK?
She's just taking a picture of your heart, OK? You on your ECG, you've got what we call like a T-wave abnormality.
An abnormal heart reading could be caused by a variety of conditions. Whatever the reason, it needs to be investigated.
So I honestly think that it would be a good idea to go and have a blood test done up at the hospital, especially with the pain that you're in at the moment. Yeah? OK.
I've taken so much blood tests already.
I know, you feel that you've got none left.
Am I gonna... Do you want me to lift you across, or... 1, 2...
I'm sorry, darling. OK, do you want to lie back a bit?
As Aman has taken so much prescribed pain relief already, gas and air is the only thing the crew can give him.
One in the very front.
Akib has been accompanying his brother to hospital appointments, but there's still no further forward.
Has he actually been formally diagnosed with anything as yet?
No, not yet.
Right, OK. So literally all the medication is just purely to control pain?
As far as I know, they're saying there's
Extreme caution.
very high
When the door opens.
infection in his blood.
Right, OK. Have you eaten anything today? You have? And did you manage to keep it down and everything like that? Yeah, you've not been sick. OK. And how long has this been going on for?
It's been on for altogether 3-4 months now, I think.
3 or 4 months, and he's lost 3 stone in that time?
Yeah.
OK. We were thinking maybe cancer because of the things that we were picking up on. The best thing for him is to get to A&E and just get some further tests run.
They're at the hospital within minutes, where the doctors will try to manage Aman's pain, while he has further tests to find out why he's been so unwell for the last 3 months.
You're going to feel a couple bumps coming out of the ambulance, OK?
What did the brother say?
I was asking the brother about the condition, like, you know...
Why he was on so much pain relief?
Yeah. He has been in and out of hospital the past 3 months with chronic pain in one place or another. Then he was having like loads of really bad stomach pains, sickness, diarrhoea, and at the moment they're testing for stomach cancer. I hope it's not, for his sake.
On the other hand, I hope they find a diagnosis for him, though, because that's half the battle sometimes, isn't it? And
That's
the
it, I
worry
mean-
is not knowing what you're dealing with.
Yeah.
I love ice skating.
I can ice skate.
Can you? On all fours?
No, I can.
Never am I more nimble than when I'm on the ice, would you believe?
I just
Pretty good.
seen a Peppa Pig then on the ice skates just from...
You're calling me a pig? Do you want another black eye? No, I'm joking.
Do you pre-cook the food first when you have a barbie?
No.
See, I do.
Why do you? That's what a barbecue's for.
I know, but I can't trust that I cook it properly. I can't trust that I cook anything properly.
I was going to say, can you actually
can't
trust your cooking at all?
Not really.
So you pretty much do a barbecue just to get that charcoal taste?
Yeah.
But that's the fun of it, isn't it? That's the fun of having a barbecue, cooking it, and the risk of salmonella makes it a bit more interesting, I find.
Unconscious patient in the GP surgery.
Yeah.
It's the start of Gaz Clark and Lee Timbrell's 12-hour shift, and they've been called to a doctor's surgery to a woman who's collapsed.
999 mode activated.
Unconscious, normal breathing, no indication seen unsafe. Call from authorised person. Individual lying on the floor and able to be rolled onto side. Another nice day at the office.
Updated assignment.
Was having blood test, has been unresponsive for over 5 minutes.
Hello.
They find 35-year-old Ioana collapsed on the bed.
Oh yeah, this lady called Iona. She come to have blood test done this morning.
Yeah.
Promptly passed out on the ladies.
Just as she was having the blood test. Right. What does she normally suffer from?
Well, she's coming with tiredness.
Not on any long-term medication at all. Hello, my love. It's okay, you can just relax and open your eyes. That's it. Helps you focus a bit.
She's not eaten or drank as well, which didn't help.
Didn't think so. So reduced level of consciousness for 25 minutes. Right.
She looked very pale indeed. She did look generally unwell. It could be any number of different things. It could be having a simple hypo, malnourishment, dehydration, fatigue. It could be a virus. There's 1,001 different things, and without starting initial observations, we can't narrow it down at all.
Right, my love, just going to take a spot of blood out your finger. Right, sharp scratch.
First thing is why is the blood pressure dropping? Is it cardiac related? It's then a case of, has she got loss of blood, having a bleed internally? That could be dropping the blood pressure. The heart's trying to do its job. It's just got no fluid to work with. And when a patient can't even be conscious in that position, lay flat, then there's something drastically wrong.
All right, young lady, we need to put some sticky dots on your chest, OK?
Paramedic Gaz Clark and technician Lee Timbrell have been called to a GP's surgery, where a woman has passed out while having a blood test. She came to the doctors because she collapsed at work earlier that week.
Have you got any pain anywhere? Your head? How old is our young lady?
35.
Slightly peaked T waves in a few of the leads.
Whenever Ioana tries to sit up, her blood pressure is dropping, causing her to pass out.
Open your eyes for me. Just breathe normal as well. OK? You have to consciously make an effort to breathe and make a horsing sound. OK? That only happens if your head's on your chin like that. Right. If you just sit forward for us.
Just bend at the hips.
Yeah. Your oxygen levels are fine.
Ioana is struggling to find the energy to move.
That's better. No worries. Do you want a sip of water?
Ioana moved to the UK from Romania 8 months ago to be with her boyfriend and to find work.
What do you do as a job?
I work in a warehouse.
Manual stuff. Quite physical. Not easy work at all. Working in an office is quite easy. Warehouse work, packing. It's hard work.
I was off this week because I was sick at work and I left with an ambulance.
Were you sick as in vomited-wise or collapsed? Collapsed, right.
Ioana works long hours at a car factory handling heavy equipment. It seems to have taken its toll on her body.
When you were led down, your blood pressure was OK. When we sat you up, it has dropped. Now, obviously, something's causing that, whether it's a touch of dehydration or whether it's a bit of a virus or an illness.
I need to go home.
No, you're going to hospital. You're in no fit state to go home. You can't stand or walk, so you're going to hospital. OK, you have got a radial pulse, so you will be able to stand and turn. That's it. And sit down. OK, we'll stand up. That's lovely. That's fine.
Excellent.
And put your feet up. That's it. There we go.
I'm so cold.
So your body temperature was OK. So you may have an illness which is tricking you into thinking you're cold.
Whenever you're ready, Lee, we'll have a trundle.
Okay.
Any kind of warehouse work, whether it's packaging, whether it's collection,
I'm carrying cardboards all day long.
it's physical. Yeah, it's long physical hours, it really is.
And it's 44 hours per week.
Yeah, of graft, working properly. How have you been eating?
Not so much.
Not really an appetite? No. No, we've got to ask you certain questions now. Have you got plenty of food in the fridge? Have you got food in the cupboards? So you can afford food? Yeah?
Gaz is concerned that Ioana isn't taking on the calories her body needs for such a labour-intensive job.
Yeah. So obviously there's not much of you, and that's probably because you do a very physical job. So all the energy you eat, you burn up really quickly. But we have to ask these questions.
And you know what the problem is that I have? On 30 this month, I have my probatory meeting to get a permanent contract at the company.
Right.
And I'm afraid if I will be absent from work,
Yeah.
they will fire me because of that.
If you're medically ill, they can't.
They will find the reason afterwards. Fire me.
Right. So we need to get these blood tests done. Because this is all documented, you'll have all the information and everything.
Doggy. I like dogs.
Britton said you've got cats.
Yeah, I do.
I
I like dogs. I can like both. A cat looks after itself, it licks itself clean.
Gives you funny looks when you walk in and disturb his peace.
I'm coming back as a cat. I've decided. I was thinking of either a Labrador in a middle-class family or a cat.
A Labrador in a middle-class family. Any particular reason why that's specific?
Because they have a better life than most people in the area. We've got a waiver!
Oh, what, you're considering because they'll have like sirloin steak and stuff, is that what you get?
Oh, yes.
Right, okay.
I've hit that 2 hours left brick wall now.
Yeah, me too.
This heat really isn't helping.
It's still 23 degrees. My mum sent me a message earlier on.
Yeah.
That said, so the air temperature's 31 degrees and the pool temperature's 24 degrees.
You're joking?
Yeah. Your stepdad's in the pool. Great. Thanks, Mum. And I'm here, sweating to death in my little green jumpsuit.
But Hannah and Michelle don't have time to cool down. They've been called to a toddler with breathing difficulties.
It's a 2-year-old with croup. And it's worse than him.
Right. What's been happening then, Chip?
He's got, is it, got a copper and is it croup?
Croup? Yeah. How do you know he's got croup? Has he been to the doctor?
Yeah, earlier tonight.
Hello, sweetheart.
What's his name, Jenny?
Ollie.
Croup is an infection of the windpipe and the voice box, which makes it difficult to breathe.
Hello, mate. Has he slept at all tonight?
This is the first. He's been asleep for about half an hour.
Okay.
And then when he had bronchiolitis, not last year, the year before, and his oxygen levels dropped.
Okay.
So it just scared me. He's been with his nan today.
Okay.
So I've not had him all day. She said that he had a bit of a cough and then he went in a swimming pool and then it came back, then the cough got worse.
Right, okay. Is it?
Then I've come back and they said it's got worse since he's woke up and then his breathing's got worse while he was asleep.
You've been swimming today, mate?
Does she have any, like, chemicals or anything in the water? No, just water.
Yeah.
It's like a paddling pool, he was in.
Yeah. Oh, can I listen while you put that there?
Michelle listens to Ollie's chest to see if she can detect signs of further infection.
You put it underneath your vest. There we go. Oh, should we try the other side? Oh, wow. You're very brave.
He's a good boy, isn't he?
Chest is clear, it's just up here.
Up here, mate. Okay, darling. Croup is an inflammation of the upper airway that affects young kids. So anywhere from sort of 6 to 8 months when they start to develop. And then once they get to sort of 7 or 8 years, I think they basically grow out of it and you won't have croup again. But with croup, if it's not treated, the same as any infection, it can get into your bloodstream and what they call sepsis, which then is a lot more serious and needs like IV antibiotics and fluids and stuff and treatment at hospital. So it can be quite dangerous if it's not treated properly.
Did they check his temperature when you were up there?
In the consultant room, yeah, and it was 37 point something, 8.
Okay. Should we just check it again on ours?
If a child's temperature is higher than 38 degrees, it can be a sign of a serious infection.
Listen to his chest and stuff.
Can I take your temperature like Mummy did? Yeah, ready? Let's have your ear then. Ready? Bit cold, mate. Really carefully. You tell me when you hear the beep. Did you hear it, Ollie?
I do.
Yeah. 38.9, that's it.
38.9.
Yeah.
So it is high.
I think we better take him to see the doctor, young man.
Yeah, I think it's worth a trip.
I'm not letting it's breathing. What do you think of that?
His chest clear, it's all up here.
Is it breathing? Is it sucking in there?
It's when they have croup, they get like a it dries their airways out more than anything else. So you know that, like, they call it seal bark when he was barking then, and it's like quite high pitched. It's because all his airways are dry and they get a bit constricted at the top rather than at the bottom.
Kind of need something to help them breathe.
So what you'll probably need is some antibiotics and sometimes give him steroids as well.
With us, so.
Whilst Mum Rachel gets ready, Hannah and Michelle keep Ollie entertained.
What you got in here then, Ollie? You got anything good? You got a ball, Paul? Is that yours?
Ball?
Yeah. Did you play with the balls? Yeah. You're a lucky boy. What's your favourite colour, Ollie? Should we see if I can juggle? It's been a while since I've done this, Ollie. You'll have to bear with me.
Wait, look at that.
Oh,
Can you do that?
Do you want to try? I bet you're better than me.
Yeah,
you try then. See if you can get it in the pool.
You can get it in the ball.
Get it back in the pool.
Yeah!
He's got a good arm on him, look at that. Good lad.
Just glad I've not wasted somebody's time.
No, not at all, sweet.
Sometimes we've had the mate and there's but no, doesn't need to go to hospital.
He's obviously got croup and it's not going to get any better until he has something done with it. And if he's already had he's already had Calpol and his temperature's still high, then obviously he's still fighting the infection. Ollie's mum definitely did the right thing by calling us, because you never know with kids, and his breathing just sounded really, really odd, which had worried her obviously, which is understandable because their breathing does sound quite strange. And with kids, they'll compensate for a really long time, and then when they stop, they just get tired, and they just get really poorly really quickly. So it's always best to err on the side of caution when it comes to kids with anything really. Hello, Ollie. And then we're going to put you in your special racing harness, Ollie.
Wow.
Do you want to see the special ones? You ready?
Timer cancelled.
Oh, look at that.
The bright lights are switched to blue to keep Ollie calm and relaxed.
There we go. Where's she gone, Ollie? Is she going to drive the needle for us?
Oh, here we go.
Okay. On my hand.
There you go. Nino. Shall we sit Teddy next to you? Pop him next to you. How long's he had the cough for, Mum?
Today.
Just today.
Yeah. I think I've caught it at the right time, haven't I?
Yeah, I'd say
it can get
so.
quite bad, can't it, Craig?
In the worst cases, croup can cause severe breathing difficulties.
Where are we, Ollie? Where are we? There. Oh, that's bright. What's that? The back of the ambulance.
How are you doing, Ollie?
Should we go in the hospital?
Did you have a nice ride?
There you go. Right, okay, now I've got to wait again.
Just seems to be not slow. We just seem to be non-stop today. It's you, that's why. Is it me? It's you? It's me. Too quick. Too quick, too eager. I'm short like a mouse, which we've clearly clarified.
Definitely clarified that one.
And I'm a little whippet.
Are you going to slow down now?
I am, I've got to slow down.
Mode activated.
Paramedic Lee Farley and technician Joanne Harris have just come on shift. They've been called to a patient with a heavy nosebleed.
19-year-old male, severe nosebleed in Wednesbury. Obviously, we'll find out more when we get there. So it's just here. Let's book us in attendance. Hello, come to see Aidan. Yeah. Aidan, hello there. Do you want to just have a sit down for me? So my name's Lee, one of the paramedics, and this is Joe. Okay, what's been happening with you?
I've been kind of ill, but then I've got over the illness and I've started having nosebleeds and coughing up blood the past few days.
So how many nosebleeds would you say that you've had?
For the past few days, about 7.
Have you suffered with nosebleeds before this? No? OK.
Hayden is a single dad to 19-month-old Leo. His girlfriend Emily is on hand to help out.
I'm going to pop this on your arm on the other side as well.
How's your health normally?
None, it's good.
No, there's a lot of ongoing issues with like, asthma or anything like that?
No, I was
OK.
born with asthma, but then nothing.
You've grown out of it, haven't you?
Although Hayden's nosebleed has now stopped, Lee and Joe don't know what's caused it. They're worried it could be a sign of something more serious.
Any headaches, any pains at the moment?
When I was ill, I had a lot of headaches just from standing up and stuff like that. And walking around, I'd get a migraine headache to the point where I'd have to go and sit back down. And I've also had a slight weakness in my body, like my body started feeling weaker than normal. And my muscles have started aching, like my shoulders, my back and all that type of stuff. I don't know why.
OK.
I'm going to put these on your wrists and your ankles.
What we're doing here, Aidan, we're just having a general overview of your health, OK? So we're looking at your blood pressure, your heart.
Like, when I was young, I did have something wrong with me because I did get into an accident when I was 3 and something happened to my brain, but I don't know what happened to it. Like, I was never told the story because I was only little. But I know I did die in the accident twice. Something did happen to my brain,
interesting,
but I don't know what actually happened.
But this general illness that you've been suffering with over the last 4 days, any signs of like infection, any like chesty coughs or sore throats or anything like that?
I've been being sick as well. It's been coming up with blood in the sick as well.
OK.
But then Lee notices something quite unusual.
So just having a look at your ECG at the moment. You've got a little bit of an irregular rhythm. Has that ever been mentioned before? OK, so you're having a heartbeat. And then the heart's chucking out like an extra beat.
Yeah, my heart has done that. My heart does stop.
Yeah?
It's kind of weird.
When we put the dots on for the ECG, it was sort of something else is happening here, so...
It did take me by surprise what we were seeing, really, in a young man that appeared generally quite well. Have another feel of your pulse. Just relax this arm. The nosebleed that we were going to initially had finished, but it still required assessment. Certainly not expecting to find underlying conditions that he wasn't aware of.
Lee needs to have a more detailed look at Hayden's heart.
All right, Aidan, just drop your arms down for me, nice and relaxed, OK? Do you get any palpitations in your chest, any chest pains, chest discomforts? Do you feel like your pulse is racing or
Sometimes
pounding?
I do get chest pains and sometimes I do get heart pains as well.
Has that been investigated?
Never been investigated.
OK.
You've not told your doctors? How long's it been going on for?
Since that accident, really. I've always had problems with my heart after that accident and stuff.
Lee and Joe decide to take action. Hayden needs to go to hospital for further checks on his heart and leaves his son Leo at home with his girlfriend.
Take a sit on this one for me, please.
The trauma caused to Hayden's head as a child could have led to him suffering a brain injury as well as damage to his heart.
So when you were 3 years old, then you were involved in this road accident. Was that something that you was like run over, or were you in the car that had a crash?
No, I was run over.
And you died during that event as well?
The driver mounted the pavement, blood was all on the pavement.
Okay.
And apparently, like, my whole body was kind of squashed.
Oh dear, so lots of fractures.
Yeah, and obviously my foot was broke, my leg was broke. Something was wrong with my brain as well, apparently what my mum was saying. There was so much blood gushing out of my head.
Has that affected you in your adulthood?
I feel normal, but my brain doesn't think normal, if that makes kind of sense.
Okay.
I don't know what it is. And I've got this, like, for some reason I get angry at certain things and I shouldn't get angry. I know to myself I shouldn't get angry at certain things.
And you relate that to the accident, do you?
I relate it to the accident.
So you call for the nosebleed and we take you in because of your heart?
I said that.
So that's good, isn't it? Okay.
Hayden will need further investigation to find out more about his irregular heartbeat.
Okay, you come with me then, we'll go and get you sorted. Well, I wasn't expecting a 19-year-old to have
Wasn't expecting him at all.
ECG changes.
He said he can remember the accident as well. I can't remember anything at that age.
Should I ask him if his middle name's Lucky?
Yeah, it must be. He's like a cat.
The day Susan had her panic attack is a blur to her. In hospital, doctors told her she had muscular pain, and it was that pain which had caused her to become anxious. She's now joined a support group and hasn't had any more panic attacks. She's still spending lots of time with her grandchildren. Aman, who was suffering from extreme stomach pain and under investigation for stomach cancer, was discharged from hospital the same night, as doctors thought the pain was muscular. But after biopsies and extensive investigation, he was finally diagnosed with tuberculosis. He's on medication now and making a slow recovery. Ioana was taken to hospital after she collapsed at the GP's during a blood test. The A&E doctors think her fainting episodes are down to her being anemic and suffering from exhaustion. After some time off, she went back to work at the car factory, but hopes to find a job that will allow her to use her marketing and tourism degree. 2-year-old Ollie, who was suffering with croup, was given steroids when he went to hospital. He didn't need to stay in overnight and is now back at home playing with his mum. Hayden, who called an ambulance because of his repeated nosebleeds, ended up in A&E when the paramedics found he had an irregular heartbeat. After tests, Hayden was told there was no cause for concern about the heartbeat, but they never worked out why he was having nosebleeds.
You have reached your destination.
Oh, thank you, Lord.
Alex Jones helps a pair of siblings look for their father at 7 in The Secrets in My Family, then at 8 getting to the heart of the problem. Tune in for Dr. Christian. We'll see you now. We're back inside the ambulance next.